orthopedic surgeon and sports medicine physician, and today I'm reviewing BMX racing, BMX street, and BMX tricks fails. Yeah, that's what I'm doing today. So before we get started, welcome to my channel where I make orthopedics and sports medicine easy to understand. Now, BMX racing is not something that I follow very frequently. I did have a BMX bike when I was young. I think it was called like the Red Baron or something like that. Since then, I have not been on a BMX bike, and I have not followed or watched BMX racing or BMX trick or anything like that. So all of these videos are gonna be new to me. For the purpose of this video, I tried to collect a bunch of different videos about BMX from different BMX disciplines, including BMX racing, BMX street, and BMX tricks. I'm gonna comment on the injuries that occur and how I think those injuries should be treated. Let's get right to it. Okay, so for this first one, we have a young man who's riding his BMX bike in the street. And he just, it looks like he's out in front of his house and he's just riding, just kind of doing a little bit of tricking here and there, and let's see what happens. Okay, so he attempts to do a trick. I'm not sure exactly what that trick is called. Maybe it's called tail whip or something like that. If you know what that's called, be sure to let me know in the comment section down below. The only thing that I could do on my BMX was basically to do a bunny hop. But at any rate, so he does this trick, and when he does so, it appears as though his foot slips off the pedal. And because of the momentum with him moving forward and spinning at the same time, he basically rolls over on his ankle, and we can see that his ankle basically ends up in a position 90 degrees to which it should be, with his foot facing back towards the middle of his body. So this is basically a supination, external rotation, meaning that his foot has turned towards the outside. And this is a mechanism that will usually result in a fracture, dislocation of the ankle. And with this mechanism of injury, there is usually a predictable series of events that can occur. Typically, the patient will have a short oblique fracture of the fibula, which is the smaller of the two bones at the ankle. In addition to that, they may also have a posterior malleolus fracture. This is a fracture of the back of the tibia, which is the bigger of the two bones of the ankle. Also have a fracture, a small fracture of the medial malleolus, which is another part of the tibia, which is again the bigger of the two bones at the ankle. Usually there are also a number of associated ligament sprains that occur with this injury. While it is not mandatory for all three of these fracture types to occur with this injury mechanism, it is, however, possible for all three of these fracture types to occur with a supination, external rotation type of fracture. I don't know, but that sounded like a lot of science. So let's move on to the next one. So this next video comes to us courtesy of the MTV TV show Scar. So in this video, we have a young man who is attempting to jump down 2 flights of stairs.
What's going on, guys? I'm Dr. Chris.
No, he's not.
I'm a doctor.
No, you're not.
And I'm here to tell you doctor facts.
Apparently, Dr. Chris has been hijacked by Rory Thunderbird.
Dr. Chris gets DDT'd by real superhero. Dr. Chris gets choked out. How long did it take to get choked out?
I don't know. I had my chin down a long time.
Rainbows usually have a treasure at the end.
Well, I'll let you do your thing, Pops.
Thanks. And generally speaking, a flight of stairs is approximately 10 feet. And a distance of, I don't know, at least 50 to 60 feet with no helmet. He actually does successfully jump down the flight of stairs, and all looks to be okay. Until, of course, the split second when the tires touch the pavement on the downside of the stairs. And when that happens, well, we see that his front tire basically explodes. We can see that the front of the bike collapses, and basically this young man face plants into the pavement. Pow! Did I mention already that he wasn't wearing a helmet? So he basically face plants onto the pavement from a height of 20 feet after jumping a distance of about 60 feet with no freaking helmet. To add insult to injury, not only does he face plant, but then he basically slides on his face for a distance of 15 to 20 feet before he comes to a stop. We can then see the ambulance attendants who have arrived and who are putting a collar around his neck and basically loading him into the ambulance. And although we don't get a close-up look of his face after he's crashed, we can anticipate some of the injuries that might occur from this type of mechanism. Certainly, we can expect there to be some facial lacerations and abrasions. In addition, we might expect that he would also have suffered some sort of facial fracture in either his mandible, his maxilla, or even around the eyes or the orbitals. These are all common injury patterns with blunt facial trauma. Other injuries that we might expect would include injuries to his dentition or his teeth, as well as some kind of closed head injury, such as a concussion on the low end or a subdural hematoma on the high end. We can see here that after having recovered, that the rider describes some of the injuries that occurred. Lacerations and abrasions of the face and also of his upper extremities, in other words, his hands and arms, and the loss of a tooth for which he now has a bridge. But in my opinion, if that's all that he suffered after falling from a height of 20 feet directly onto his face on the pavement at a high rate of speed, then I think this dude is actually pretty freaking lucky. So for this next one, we have a rider who is known on YouTube, and his name is Jack Mold. And we can see here that he is practicing his BMX tricks inside of a ride park. And although I don't know what the name of this trick is, basically he is trying to do a front flip with a 540-degree twist at the same time and land on the ramp in the opposite direction and ride away. But in this particular case, he does not land the trick successfully. As he's approaching the ground to land this trick, his left foot slips off of the pedal and lands on the ramp, while his right foot and body remain on the bike. As the bike rolls away, the planted foot turns to the outside and externally rotates away from his body. This results in a fracture dislocation of his left ankle by a pronation external rotation mechanism. This, of course, is a different mechanism of injury than what occurred with the first rider that I showed you. As with the first type of ankle fracture, this mechanism, the pronation external rotation, also has characteristic injuries that occur. The progression of injuries that is typically associated with a pronation external rotation type of ankle fracture includes a transverse fracture of the medial malleolus, or the inside part of the ankle, a short oblique fracture of the fibula, which is the smaller of the two bones of the ankle, and then finally a posterior malleolus fracture of the back of the tibia, which again is the larger of the two bones of the ankle. This, of course, is an injury that will require a closed reduction in the acute setting. If after the reduction, the x-rays show that the ankle fracture has been anatomically reduced with no displacement at the joint surfaces, then this is a fracture that may be treated in a non-operative manner. However, if after the closed reduction there is greater than 1 to 2 millimeters of displacement at the joint surface, or if there is widening of the syndesmosis, which is the space between the two bones, the fibula and the tibia, or if the mortise of the ankle, in other words, the joint space that is created by the fibula, the tibia, and the talus underneath, if there is widening of the mortise, then this is an injury that will require surgery. And generally, this would be an open reduction and internal fixation with plate and screw fixation on the fibular side and screw fixation on the medial malleolar side. And if you don't understand anything that I just said to you and your head is spinning like a freaking top, then let me summarize it for you in the Cole's Notes version. Basically, with this type of injury fracture, you're gonna break possibly 1, 2, or 3 parts of your ankle. This is going to mean that we need to put it back into place like this. If it doesn't look good enough when we put it into place like that, then we're gonna need to cut you open and we're gonna need to put some plates, screws, and other hardware in order to make sure that it looks pretty on the x-ray and it works like it's supposed to.
Okay.
Usually this is an injury that will take somewhere in the neighborhood of 6 to 8 weeks to heal. And if all goes according to plan, once it is healed, you'll be able to get back to riding a BMX bike just like you were able to in the first place. There have been numerous videos about riders trying to tame El Toro. It's a big set of stairs. So in this particular video, this rider wants to take it up a notch. So not only does he attempt to jump the full set of stairs, but he decides that he is going to basically do a 180 on his approach to the stairs and then jump the stairs. YOLO. So let's get it. And once again, he is attempting this maneuver without a helmet.
YOLO. So let's get it.
That's not my official position, by the way. You should wear a helmet. Helmets will save your life. But apparently these guys think they're not cool or something because they just don't wear them. So we can see that as he approaches, he's gathering speed. Everything looks good. Plane is getting ready for takeoff. He does the 180 and then he basically jumps. Before he even gets halfway down the stairs, that something is wrong because he is already halfway off the bike. And then as he approaches the ground, we see that he has basically become separated from the bike and he is not going to land anywhere close to the bike. Fortunately, he approaches the ground feet first, which actually gives him an opportunity to absorb some of the shock as he impacts the ground. However, as he still has his forward momentum and he continues to rotate throughout the air, as he lands with his feet on the ground, his body is whipped back, causing him to strike the back of his head into the ground on the pavement.
What you say?
And although it appears that he strikes his head on the pavement, it is not until we see the slow-mo view from the opposite direction that we see the true mechanism of his injury. And here we can see that this rider is extremely, with a capital extreme, extremely fortunate because he does not actually strike his head on the pavement. In this particular case, we see that the bike, which is falling to the ground behind the rider, actually bounces into the air and subsequently strikes him in the head, which is what causes the laceration. As the cameraman quickly comes over to his assistance, we can see that he is awake and with a normal level of consciousness. Unfortunately, he has a large laceration within the hairline on his head, but this appears to be the extent of his injuries. Although he did not tame El Toro, it seems that he got away lucky with only a laceration to his scalp. Perhaps he'll consider wearing a helmet the next time. Okay, so let's go on to the next one here. We have a young man who is actually wearing a helmet. I'm gonna give props to this young man because he is wearing the most important piece of safety equipment. He is wearing a helmet. And he's basically riding in a skate park, attempting various tricks. As he comes up the ramp, he attempts to do a forward flip. And unfortunately, he becomes separated from his bike. Once he is separated from his bike, he begins to rotate faster than the bike, and he therefore comes into contact with the ground before the bike does. As he makes contact with the ground, we see that his left foot touches first, and his body continues to move forward while the left foot is planted. With his left foot planted and his body still moving away from the planted foot, his left foot pronates and then externally rotates away from his body. I've said this several times in many of my other videos. Bones are awesome in compression, but they absolutely suck in rotation. And here, there is no exception to this statement. We can see here that the bones of the ankle hold on for as long as possible, but eventually the fibula gives up and we have a fracture dislocation of his left ankle. As with the injury to Jack Mold, we can see here that the rider has suffered a pronation external rotation injury. So we've seen a number of injuries that have occurred with BMX Street and with BMX tricks. But now let's look at an injury that occurs with BMX racing. So in this video, we have some riders that are going over a series of whoops. And as they do so, two of the riders become tangled in the air. One of the riders ends up beginning to rotate in the air, and he lands off of his bike, colliding with the ground. When he contacts the ground, he does so upside down with his head and neck in forward flexion. This may often be a fatal injury mechanism. And we can see here that when the rider contacts the ground, immediately his body goes limp. This may be because, one, he has suffered a loss of consciousness and no longer has motor control of his body. Or this may be because, two, he has suffered a spinal cord injury at the level of the cervical spine and he no longer has motor control of the spinal segments below the level of the spinal cord injury. Of course, this presentation may also be a result of him suffering both of the above. But until first responders actually examine this rider, it is impossible to tell which of these mechanisms has occurred. And although we don't get to see the actual injury pattern that did occur, we do hear the narrator say that this young man suffered a fractured cervical spine.
He suffered a broken neck.
Fortunately for this rider, after undergoing fixation of his cervical spine with bone grafts from his pelvis, he was able to make a full recovery following this injury.
With a combination of courage and a bone transplant from his hip, Matt made a full recovery.
This outcome is extremely fortunate because the cervical spine fracture pattern that typically occurs with this mechanism of injury is called a flexion teardrop fracture. And unfortunately for most, the flexion teardrop fracture has a high incidence of corresponding neurologic injury. The flexion teardrop fracture typically occurs when there is severe compression of the cervical spine combined with forward flexion. Usually, the anterior or forward structures of the cervical spine are compressed, while the posterior structures, in other words, the structures at the back, are distracted, which can cause significant instability of the cervical spine. You may even have forward translation of one segment of the spine over top of the other. This is typically associated with transection of the cord. In other words, the spinal cord gets cut in half, and that's usually a bad thing. Oftentimes, there are fracture fragments of the bony vertebrae which are pushed backwards into the spinal cord, resulting in a spinal cord injury. One thing that I can tell you for sure is that none of that sounds very good. So there you have it. Today I've been reviewing BMX racing, BMX street, and BMX tricks fails. I hope you've learned something about ankle fractures and cervical spine fractures as well. If you liked the video, be sure to give it a big thumbs up and share it with somebody that you know. And if you've ever suffered an injury from BMX racing, BMX street, or BMX tricks fails, then let me know down in the comment section down below. And as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.